Good morning, everybody. I want to welcome you all, and before I begin, I want to remind you that you are in a webinar format and you will be able to interact with us using the question and answer and chat format. Also, before we begin our program, I want to remind you, if you need to use closed captioning, please hover your mouse to the bottom of your screen, to the bottom right, and you'll see a closed captioning option. Please click on that option and pick the closed captioning that works for you. And today is the last day to fill out your census. So if you haven't already done so, please go to the link that you see in your chat right now, open a new tab, and fill out the census right after we're done today. So good morning. My name is Protima Pandey, and I am the manager for Office of Women's Policy, Division of Equity and Social Justice, County of Santa Clara. On behalf of Alliance for Girls and the truck that's passing by my window, we zoom into Zoom. On behalf of Alliance for Girls, the California Partnership to End Domestic Violence, and the Division of Equity and Social Justice, Office of Women's Policy, Office of Gender-Based Violence Prevention, County of Santa Clara, I welcome you to this morning's legislative briefing. I thought about what I wanted to share as we move along today to learn about the challenges that we have to work with when we're dealing with a pandemic within a pandemic. And I realized that I want to begin by sharing with you what the Division of Equity and Social Justice is working towards. With 7 offices in the division, we're focusing on intersectionality, on survivors who may also need services because they're limited English proficient, or because they're young people, or because we're members of the LGBTQ community. And I wanted to share that the work that each of you are doing out in our community right now, while we're in a global pandemic, is challenging, but also it's a way for us to remember that there are others that we can reach out to for help, for ideas, and for brainstorming. And so today really is a brainstorming moment. In the work that I have done with survivors for the last decade and a half, the most important challenge that I have faced every single minute is, how do I ensure that the survivor hears from us, the service providers, that we are here, pandemic or not. The pandemic is not equalizing. We have seen what's happening with the COVID-19 pandemic. And we all know that in the lives of survivors of gender-based violence, the life and the moving parts of their lives are what we as policymakers, as advocates, as direct services providers are all working to deal with. And I want to begin this morning's briefing by asking everybody to remember that you are not doing this work alone. In 2010, when I was lucky enough to be an employee at the California Partnership to End Domestic Violence, the most important lessons that I learned was when community of advocates and allies came together. And so this morning, with your community, I ask you to participate in finding ways to continue to protect our survivors, to continue to advocate for each one who walks through our door, and to remember that prevention goes along with services, goes along with funding, goes along with advocacy, because we're going to hear about each of those aspects. And now it is my honor to introduce our President of the Board of Supervisors for the County of Santa Clara, President Cindy Chavez. This morning, President Chavez will get us going. And as you can see from her biography, we have a wealth of riches. But what I call President Chavez is our champion in the County of Santa Clara. Even when I was providing direct services and not a county employee, I looked to Santa Clara as having set the gold standard in the state of California. As you can see, President Chavez wears many different hats, but I definitely want to talk about how she has pushed together all of us to do more for survivors, to continue to elevate the need for prevention and services and housing and shelter and strategic collaborations. And with that, it is my great honor to turn it over to the supervisor, to the president of our Board of Supervisors, County of Santa Clara, President Cindy Chavez.
Thank you so much, Protima, and thank you for getting us started with such energy and focus. I'm excited about being with all of you today. You know, I realize that I'm talking to people who are living the work every day, and so I don't want to preach to the choir. What I do want to talk about is, given the really challenging times we're in, how do we keep building the resources that our community needs? What are we going to do to be proactive and protective? And even during budget cuts and shifting priorities, how do we make sure that the people that we most want to serve, these mostly women and their families who are leaving violence, and what can we do as a community, as a team, to work together to make that happen? So what I thought I would do is take a couple minutes just to talk about what we've been doing in Santa Clara County, and then challenge all of us to think about what are the next steps that move us to where we most want to be. So many years ago, actually even before Protima joined us, working with the Office of Women's Policy, we developed this working group called the IPV Task Force. And the Intimate Partner Task Force was really created with the idea of getting lots of people around the table, traditional and non, to take a look at what we were dealing with. How could we be more effective? How did we get the community engaged, right? What came out of that was the first tranche of funding and highlighting and lifting up the needs of our community, whether they were undocumented, whether they were LGBTQ, whether they were men who we needed to treat also. And that emphasis got us going on a path that really has set the stage for what's come after. So out of that first tranche of dollars, what we got was money to begin working on the on intimate partner violence in a much broader way with many, many more partners. That was our first tranche of almost $5 million over a number of years that went into that body of work. The next tranche was really focused on prevention. So we gathered the community, we did a public hearing. That hearing identified the things that we most need. We went to our board colleagues, got the second tranche of $5 million. Many of you may remember that the state of California cut the amount of resources they were giving to our rape crisis centers, which is still appalling to me. And that, again, because we had this community built up, we gathered together, we got in there, and we got another $2 million for that body of work. Another body of work, you may recall when the federal government was really trying to devastate the treatment that women got, poor women got, that we as a county and the city of San Jose invested in Planned Parenthood, again, keeping those relationships going, and really working with our partners like the Y and others. Now, we know that one of the next biggest needs, and it's been a need all along, is to continue to expand and invest in housing. That's newer for us, in a meaningful way, really investing in housing. And we've got another over $1 million that's invested with our nonprofit partners in housing. And lastly, and I think one thing there are kind of two big areas we're working on, is that we've expanded a program to make sure that if you're a victim of strangulation, that we have the tools you needed to make sure we can properly examine you for forensic examinations here in our community. So that's a body of work, and working with our EMTs so that they can recognize when a victim's had some sort of impairment to their airways, so that we do a better job of making those examinations and being able to bring that when necessary to court, that forensic information to court. Then the last thing we're working on right now is we're mapping our whole process for victims of domestic violence, of how fast we get them services, how fast we can get them to, if you've been a victim of sexual assault, to an exam, how fast are we able to really get you what you need in terms of counseling and those other things. why am I saying all this? I'm saying this because even though a lot's happening to push us back and COVID-19 has been such a challenge, we know that there are still resources, and we know that working together, our voices are loud. And I just want to say that if we keep working together, I think we're going to keep getting those investments. We need more money into housing for victims of domestic violence and victims of sexual assault. We got to get in there. We got to focus and make sure that we're getting those resources. I'm excited to keep working with you. I have a role to play, and that's, to make sure that when I'm sitting at that dais, I'm representing your needs and what your visions are and your expertise. You have a responsibility not just of continuing to provide those great services, but letting your voices be heard. And I think working together, we're going to keep moving the needs of our community forward, and we're going to do it in a way that's going to make people proud that they live and work and play in this county and in the state of California. I want to close by saying what I usually say when I open. For every one of you who's an advocate, a counselor, providing those services on the ground to Protima, to Carla, to the heads of all of our nonprofit partners, Esther and Tanis and, just Aaron and all these really, really good women who were leading the way. Thank you. Thank you for your leadership. Thank you for our male allies. Let's lean on each other now to build power for the people who need it most. Thank you for letting me join you.
Thank you, President Chavez. And the term champion doesn't even cover everything that you have done for survivors and for us as administrators. So for us to have you start off the day addressing is a very important way to gather the community and learn that there are leaders like you who believe in our work and who've invested in our work and who continue to push us to do more. With that, I'm going to introduce our next speaker. And while you see her biography showing up on the screen in a minute, Assemblywoman Wicks, for me, the image that I have is what we saw in the newspapers a few weeks ago. A young mother carrying her infant late into the night, doing her job, representing those of us who elected her to be our voice in the assembly. When I think about how far the Office of Women's Policy has come, we've been here for 22 years in the county of Santa Clara. And I like to joke, it's taking a long time to dismantle patriarchy. But what Assemblywoman Wicks demonstrated in doing her duty as our elected and in doing her duty as a fierce warrior mother is a reminder of how much more work we have to do. As you can see, Assemblywoman Wicks has women's rights as the core of one of the issues she champions. But I'm very proud to say that 8 of her bills were passed into law in her first year in office. And I can tell you that that's the kind of champion that we rely on, because we know that as soon as we're recovering from this pandemic, we will turn to leaders like Assemblywoman Wicks and ask her to stand by us so we can get the voices of survivors to the state capitol. Assemblywoman Wicks.
Thank you. Thank you so much for having me. I deeply appreciate being here. I'm honored to be here with you all. And I appreciate you calling me a young mother, because I don't feel like a young mother now that I have a 3-year-old and a newborn. I've gotten some of the gray hairs have come in. And women's issues are critical to me. That's why in my first speech that I ever gave on the assembly floor, I talked about the abortion that I had when I was 25 years old. And the need to have access to legal and safe abortion. That's one issue of many issues that I care about in terms of the women's work that I do. This year, I also passed a bill and got signed into law allowing women who had experienced sexual assault at the hands of a UCLA say, gynecologists to allow them to get redress for that episode in their life. And so that bill was critical, and that will impact hundreds of women who unfortunately had to experience sexual assault at the hands of one person. So there's a number of different ways that I work on women's issues. I also work on women's economic issues, healthcare, housing, and all of these are very connected. And I think what we've seen now in terms of what COVID has done in our communities, it has really shined a spotlight on the fact that many of our social safety nets are failing our underserved communities. And we're seeing that across the board. We're seeing an increase in domestic violence. We're seeing an increase in gun violence in our communities. We know that victims of domestic violence and abuse are further marginalized. There's more risk because they're spending more time at home with little outlets. We see, when you look at education, the achievement gap is widening in our schools as many of our lower income communities are being left behind because of the distance learning. We're seeing food insecurities impact our lower income communities. I've also done a lot of work in that space that disproportionately impacts women of color in particular. We're looking at concerns around our immigrant communities and our undocumented folks in our communities facing vulnerabilities with accessing healthcare. We see people who are homeless, having, issues with regard to COVID as well. And those that are formerly incarcerated, having a more difficult time re-entering our societies. Our low-income communities are having difficulty accessing our healthcare system. There's a number of issues that we are faced with our communities right now. One of the stats I just saw recently was of the 1.1 million people who left the workforce last month, 80% were women. And so what this crisis is doing to us economically as women is potentially very detrimental, generationally detrimental. And so when people ask me, when are we going to go back to normal? I always say, I don't want to go back to normal because normal wasn't working for so many people, particularly for women, particularly for low-income women, women of color, who are disproportionately impacted by some of these issues that I've already addressed. And so what does it mean to have a bigger, bolder, progressive vision that we should be fighting for in our communities and in our state and in our country? Increasing mental health resources for those that are, trauma survivors, increasing access to healthcare, increasing access to housing, which is so critical for survivors. I ran a bill this past year, and a budget ask, which worked. My first year, we increased the California Violence and Intervention Prevention Programs, which works to end gun violence. We increased it from 9 million to 30 million last year, but we need to continue to do those types of things and double down on that work. Now is the time to double down on that work. Our need for critical social safety nets is apparent. And our government's job is to help people fundamentally. And I believe the government can do those things. It takes political will and leadership to do it. But that is what, I and others have signed up for. And it's what I will continue to work for, because I know that you all on the front lines are the ones who are doing God's work, helping our communities, helping our women that need it so much. And please look to me as an ally. And I just want to take a moment to celebrate all the good work that you all are doing. And we'll be there with you arm in arm as we work to solve these problems. So I really appreciate you all allowing me to be here today. So thank you very much.
Thank you, Assemblywoman Wicks. And thank you for reminding us that the work to protect women and women's rights includes everything from assuring reproductive and gender justice all the way to food insecurity and food justice. Because otherwise, I know when I used to do direct services for survivors, it wasn't one piece that I could solve and say, okay, we're done, right? The moving pieces. And that's why I'm so blessed that today, during our briefing, I see among participants so many friends from the community that I have been honored to be part of for all of these years. And I hope that as we begin this briefing, that you continue to engage using our chat and our Q&A functions. Tell us what it is that you want to hear. We'll do our best to share our thoughts, but most importantly, this is the collective think tank. As Assemblywoman Wicks said, we rely on this think tank to move policies that are progressive, policies that are meant to elevate the lives of survivors from making them. We don't want them to be only survivors. We want them to thrive. We're all part of this work that we need to do. And how amazing will it be when we get to a place where our survivors don't have to advocate, because we anticipated and met our survivors where they needed us to meet them. Imagine that day, and that's the day we're going to build together. So with that, I want to now introduce the facilitator for our legislative briefing, my friend Carla Collins, who's the manager of our newly created Office of Gender-Based Violence Prevention. Carla Collins has been with the County of Santa Clara for a very long time, and she was one of the first staff members that joined the Office of Women's Policy when it began many, many years ago. And today, with Carla's leadership, as you can see, we've grown the investment that the County of Santa Clara has made to serve survivors of gender-based violence up to $12 million. Many of the stakeholders from Santa Clara that have joined us are also doing a lot of work on prevention. We have law enforcement partners, we have probation partners, and with Carla's leadership, we'll continue to grow what we need to do in order to build a community that comes together to serve survivors where they need us. So I'll turn it over to Carla Collins.
Thank you so much, Protima. And it was actually very difficult to leave the Office of Women's Policy, but because we work together in the Division of Equity and Social Justice, it's wonderful to be in this new role, which has only been around for this last year. It's a brand new Office of Gender-Based Violence Prevention, part of the Division of Equity and Social Justice in our at Santa Clara County. We're really proud of what we're doing and how we partner with the other offices and with other county departments, and of course, most importantly, with our community partners to really transform the way our county is addressing gender-based violence. And you've heard a little bit about that, and you see the incredible leadership we have with our board president, and really the other members of the board have been absolutely supportive as well. And certainly having over a $12 million budget has been a game changer, because it really does allow us to invest in community and in innovation. And so we're able to really address the full spectrum of these issues and try new things and see what's working. And if something isn't, we're going to course correct and try to do better. But this is an exciting, exciting time for us. And I am so honored to be here today with some incredible panelists too, who are going to lead us in a conversation, is what we're hoping to have, around very serious, very important issues, so that hopefully you'll all come away later with some ideas maybe that you hadn't thought of for your own communities that you can implement or support, and ways for us to all maybe work together to make sure that those in our community who are the most vulnerable are the most protected. So it is my honor to introduce some of our panel members today. I'm very excited. We have from San Diego, Jessica Valencia. She is a prevention and community engagement specialist, and she's so passionate about working to end sexual violence and dismantle the roots of oppression. She's a graduate of SDSU. She has a dual degree in women's studies and Spanish, and a certification in Spanish English translation and interpretation. She's committed to community engagement and volunteers with at Manita's Youth Leadership Mentor Program, and is very active with the California Latinas for Reproductive Justice. Let's see, we have others on our, and I think they're going to be joining me here. We have Kalila Jordan. She's our youngest panelist. She is 17 years old and just recently graduated from El Cerrito High. She's currently a psychology member and has been part of STAN's Youth Against Violence program for about 3 years now. And she's going to talk to us, bring us a youth perspective, but really share how being part of this program has drastically impacted her life and opened her eyes to the harsh reality of domestic violence as well as teen dating violence. And I believe we have Suzette Shaw. She's a Skid Row resident who writes, talks, and advocates Skid Row from a woman's perspective. So for those who might not know, Skid Row is a contained community in downtown Los Angeles with which tracks the highest homeless population in the entire United States. Predominantly Black, with Black middle-aged to elderly women is the #1 demographic decade after decade. Suzette says her pain fueled her testimony, and her testimony has now fueled her advocacy. She expresses herself through poetry, paints a broad stroke, painting hues of pain and purpose in her healing journey, where she advocates for a shift in the paradigm towards the dismantling of systemic policies and practices which have perpetuated the trauma of the oppressed, which too often looks like her. And last but not least, we have Arya Saeed. She's a transgender advocate and award-winning political strategist based in San Francisco, very close to us. And she's the founding executive director of Compton's Transgender Cultural District, the world's first transgender district celebrating the resilience, culture, and presence of transgender people in the Tenderloin neighborhood. She's the founder of many things. She's the author of many pieces, has been in so many different platforms. She was listed in the 2019 Out 100, which highlights 100 of the world's influential LGBTQ leaders. And she's the youngest Black transgender woman recipient of resolutions from the California legislature. So together, we're all going to be having a conversation now about a pandemic. I think Protima referred to it as a pandemic within a pandemic, right? COVID has really devastated our world. And it's something that even in Santa Clara County, where we've been very conservative with our efforts to get to safety, to sort of flatten that curve, we've still had hundreds and hundreds of deaths. We still have, in fact, the first death that was reported in the nation, and it impacts so many. And what happens when the only things you can really do to stay safe are sheltering in place, wearing your mask, washing your hands, but staying at home? And if staying at home is not safe, what does that mean for everyone? Well, social inequities have certainly also deepened during the pandemic. And we want to talk a little bit and share some information around survivors and turning to our incredible panel to think about your prevention efforts and how these have been impacted when everyone is sheltering in place. I am wondering if Suzette would like to start us off with that.
Good morning, everyone, and thank you so much for allowing me in the space this morning. Definitely. So here in Skid Row, I'm a part of several grassroots initiatives, one being called No Place to Go, which a research project that started in 2017 that formed into a publication of the same name. When that research project started in 2017, it was grassroots community members as well as academia and funders alike and so forth. But what we've really found is that there were 9 public toilets for the amount of thousands of people living out here on the streets, 9 public toilets. Now, prior to COVID pandemic shutdown, we started the second phase of this research project. So I was boots on the ground almost every single day, going from block to block, encampment to encampment, and tent to tent. And it was very alarming just to realize the lack of resources that people actually have living in Skid Row, and really heightens the disalarming fact that according to United Nations refugee camps, Skid Row has been deemed as people living in less than third world living conditions. And so I'll stop there and see if you have any other questions. Thank you.
Those are important pieces to highlight, especially when something like washing your hands is one of the few strategies that we really have and need to implement. So thank you for highlighting some of those realities. I'm wondering if Jessica might want to weigh in on this.
Yes, hi, yes, thank you so much for having me. And I absolutely agree. I think the pandemic, right, the pandemic within the pandemic has been very stressful, I think, for a lot of us who are advocates in the intimate partner violence world and sexual assault world. And one of the things that we have noticed is a high increase in calls to our hotline. We have seen a 60% increase in calls. We're at the point where we have rollover shifts, where we have at least 2 to 3 people on our hotline every day to be able to respond to the needs of our community. We also have noticed we created a legal intake line. Since everything became virtual, our courts have also been virtual. And so a lot of folks have questions about what those processes are like. And we understand that not all survivors are looking for justice through our legal system. And the folks who are really confused as to what is happening. So we've also seen a high increase in folks calling our legal intake line. We have about 12 calls regularly every day. So our advocates are really, doing their best to meet our client needs and really to be available to folks and helping them walk them through this new normal that we're experiencing now. And we understand, with this new reality that we're currently living, things are changing on an everyday basis. And that's very difficult for us to be able to communicate with the clients we're serving in our community as to what is available in this current moment, in terms of resources, in terms of, alternatives to justice, in terms of healing, right? Like, what is it that we can offer? And so we're constantly trying to do better and learn and really figure out what it is that our clients need from us to be able to serve this in this particular moment in time. And so I really appreciate this conversation because it really is shining a light on conversations that may not are being reported, right? Although we're getting hotline calls, that doesn't necessarily get represented how many folks are matched with services or how many other folks may not have access, right? And of course, we're assuming when we're talking about a hotline of a phone, right, these are folks who are able to speak, right? So what about all our other communities who may be deaf or hard of hearing? Right? What kind of access do they have to services, especially when we're sheltering at home? There's a lot of barriers added to, having access to resources and options for survivors in this moment. Thank you.
So important to note. I know here in Santa Clara County, we have our 4 shelter agencies and also Maitri, which provides transitional support, but together they have worked on a really incredible and innovative program called safechatsv.org, and it's been a way for people to chat and text to get information with a confidential advocate, which is really so important for everything from doing safety planning to getting access to resources to fleeing and getting the information they need so that they can get to help. Well, one of the things I think is so interesting, this started, a few years back, and it was really designed, I think, originally targeting students and teens and people who, might be less likely to pick up a phone and call for help, but texting might be easier. Well, when you're sheltering in place, texting might be easier for a whole lot of people. So they actually pivoted pretty quickly in March and April and started to expand the services that were available there. And we're looking at ways to continue this support because it is really, really innovative and so important. And I think across the state, we saw right in March, numbers were kind of low, and that was a little concerning for everyone. I think across the board, numbers seem to be where they were pre-COVID, if not higher now. And so we really know that we need to be preparing for long-term support for families as we get through this. Let's see. Aria, would you like to weigh in on this, or do you have something you'd like to share?
Yeah, I'm so sorry, Carla. Can you repeat the question for me?
Of course. We're just starting off with the sort of overall context of this is COVID-19 and a pandemic, and social inequities have deepened during this.
Right.
I don't think it's anything new. It's just sort of highlighted some of the many social inequities that existed before, but they certainly have gotten worse for many too. So we're just curious how survivors or perhaps even your prevention efforts have been impacted because of COVID-19.
Yeah, so like so many projects, I think we have had to be really creative about how we engage with our community members, being in particular working in a cultural district context. Our work is centered around bringing people together in person for events and programming. And that has been obviously a huge shift. Our work in particular, I would say at the very beginning of the pandemic, we, in San Francisco, we were the first metropolitan city to shelter in place in the country. And I remember it was like a movie, going into the grocery store and the line is coming out the parking lot and everyone's like grabbing the last of the potatoes or the rice or whatever. And like seeing my own experience of pulling out my credit card and buying $500 worth of groceries for an indefinite amount of time of bunkering in. You know, I had talked to my team and we had this idea around doing a mutual aid fund for trans people, knowing that so many trans people already live in abject poverty, especially in our community in the Tenderloin in San Francisco. And so we launched a mutual aid fund. We had to borrow money right behind the scenes to make this a possibility. It was money that we didn't necessarily have, because we just wanted to make sure that folks were able to have access to the basic essentials for something so unexpected as this onset of a pandemic. And so I think to date, we've helped over 550 trans people with cash grants. But the need still continues. Like you were saying, Carla, the needs existed before the pandemic, but they became exacerbated during the pandemic. And so many of our folks living at the margins are having to figure out even things that I think people take for granted right now in this moment. So many people are losing their jobs and sort of waiting for unemployment to respond, but many trans people don't even have access to unemployment, right? And so when you're doing survival sex work, right, in a country where it's deemed illegal, what is your safety net? And so many of our folks are doing survival sex work during the pandemic and having to compromise their safety to eat. And then, of course, we're seeing so many trans folks who were already experiencing housing instability, having to decide whether to camp out because the shelters have been closed, or to leave the city and camp somewhere else. Of course, our city has had a hotel program, but it will end in November, as we're seeing cases continually spike overseas, right, in Europe, where the cases have declined during the summer, are and now surging. Right? And so it's like, if it's happening in Europe, then I imagine that it'll happen here. And so what are we doing to protect our folks who are most vulnerable to the consequences of a pandemic? And so that's work that I think the transgender district is trying to grapple with, of like, what is our role in creating safety for our folks, as well as so many other trans-led efforts in San Francisco.
Excellent examples. And I especially want to point out, I really applaud you for the raising those emergency funds, because we see, you know, across the board, everyone needs flexibility too, because, you know, one family might need diapers, another might need toilet paper, whatever they need to be able to have the funds that we're talking about survival now, right? And food and things like that. So increasing flexibility and how funds are distributed is also really important. Thank you for highlighting that. Kalila, did you want to add anything to this?
So what I was going to say is, so I am a volunteer at Stan's Youth Against Violence program, and we typically help prevent teen dating violence. We help the youth realize the difference from healthy and unhealthy communication, whether it's from friendships or in relationships. And we typically create campaigns around Teen Dating Violence Awareness Month, which is in February, and we try to help youth understand and recognize red flags that may appear in their relationships. My generation often normalizes unhealthy behaviors, and STAN's Youth Against Violence program helps show youth that these normalized behaviors are not okay and that they shouldn't be tolerated. And with everything that's been going on, pandemic, it's been a little difficult to spread awareness how we typically would like to at our schools and things like that. So we've just been having a lot of multiple virtual conversations about what we can do. And actually, one of my fellow YAV members actually hosted and led a peaceful protest a few months ago in the city of Richmond. It was from a church in Richmond all the way to City Hall, and it was a really good turnout. Many people had their masks, people were following the social distancing guidelines, and it was just a really good turnout.
That's so fabulous, Carla, and I'm so excited to hear some of the work that you're doing as, you know, as someone who's worked in this for so long, but now as a parent of a teenager, I realize sometimes it's different in real life from what you're thinking you can do and the conversations you can have, and hearing from peers and working with peers on this makes such an incredible impact. So thank you for all that you're doing with STAN, and I hope you can share more about that. And it really moves us to the next question really well too, because whether you have children or not, you probably know that virtually everyone is doing distance learning this year, and that it's really hard. It's not easy for anyone, I don't think, and I think people are making the very best of it in many cases, but that doesn't mean that it's been a breeze by any means. So I'm really curious, and I think it would be good if we spent a little time talking about what it means to do organizing, especially around racial and gender justice and violence prevention work. Like, you've still done really successful things during this time. So can you talk maybe a little bit more about STAND and some of the efforts that you've done pre-COVID, and then maybe a bit about how that's been changed because of virtual life that we're living?
Yeah, so pre-COVID, we typically have campaigns around our schools. It'll be wherever there's YAV members, which it could be El Cerrito, Kennedy, all the schools in our district where we are. We'll hold a campaign, and we try to basically get the word out about, we try to teach the youth better communication, because when it comes to our youth, I noticed with my generation, I even noticed with me when I first started this, a lot of things that we tolerate in our relationships are actually, it's very toxic and it shouldn't be okay, but I feel like we tolerate it because we think it's okay and it's normal, and it shouldn't be. And so at our campaigns, we typically ask the youth questions about how they would respond to certain situations. And then we get their answers, and we either tell them, like, oh, that's a really good response, or no, you should go about it in this manner. And then now with COVID, it's actually been really hard because we can't go to the schools. They can't go to classrooms and talk to classes as a whole about what's going on, what they can do better. So I feel like right now during the pandemic, all we can really do is talk to, maybe spread the word via friends or social media. That's why I said we had a lot of virtual conversations, because we can't reach it's really hard to reach as many people as we would if we were on campus talking to everybody, rather than right now, we only have access to maybe who we know.
Absolutely. I don't know if you have read, or if anyone else has seen Megan Thee Stallion's recent opinion piece. How powerful and fabulous is that, right? I hope we can amplify that all throughout the world and have lots of discussions. But bringing younger voices in and really listening, I think there are so many solutions and answers. So thank you for all of this. So grateful for your work and leadership. Jessica,
May I interject?
Sure, absolutely, Suzette.
I just wanted to quickly say I so appreciate her words, and it really just highlights how as she said, with, the current generation and the music that illustrates some of the violence that really perpetuates the trauma going on, from the Megan Stallion story to so much other, just the music has really helped to amplify domestic violence and trauma and perpetuating harm against women, and most especially inclusive of being that of Black women and girls. Thank you.
Thank you for adding that very important point. Jessica, I know you work a lot with youth. Do you have any insights to share around organizing in this virtual world and some of the changes and perhaps ways we can support that?
Of course, thank you so much. And I really appreciate, Kalila, that you mentioned, that with the virtual impacts, like it's really kind of forced us to like pivot and change our strategy, right? Especially when working with youth. And I think that's one of the realities that we encountered with our youth group, that they were very much immersed in, raising awareness around healthy relationships, talking about exactly what Kalila was saying, right? Really questioning and being critical of the social norms, the media, everything around toxic relationships. And, we had such great events. We were having such good conversations in our communities in regards to topic. And when the pandemic hit, like we've all been experiencing the struggles, right, of having to adapt, having to shift, really experiencing a lack of support, right? The reality is that the youth we're working with, basically, we're tapped out, right? There were so many social tensions and inequities that were not heightened, right? But it was like everything was amplified. And the reality is that folks are feeling very stressed out and overwhelmed, especially, I think, feeling a sense of not really knowing what to do or where to go, right? I was actually having a conversation with a youth the other day, and they let me know that they're feeling very overwhelmed at home, that, it's very stressful to be around their family constantly, and that, their boundaries may not be respected. And so that's also another reality that, in our lives, in the lives of youth that are doing this work, they're advocating for healthy relationships, they're advocating for practicing and setting boundaries, while at the same time struggling to do that themselves in their lives, right? So what we've done in terms of prevention and organizing is we have really tried to modify our work to be virtual, trying to do more social media campaigns, trying to do more lives, engaging with workshops and hosting workshops online that are open to youth. And in terms of racial and gender justice, at my agency, our team really uplifts these issues, and we really uplift having to understand the intersections of oppression and the way that it really essentially stresses the violence even more, right? The layers of the intersections of experiences of folks really can heighten the violence that people are experiencing. So we as a team have decided to interweave these topics and conversations in everything that we do. And so if we're doing a conversation around healthy relationships and we're looking at media and how it's showing up in music videos, on TV shows, right, in our ads, then we're gonna also bring in those connections of, well, what do we notice about gender? What do we notice about race? What kind of messaging are we sending folks depending on what identities they hold, right? And how does this play out in reality in terms of the violence that specific communities are facing? And so being very intentional about having those conversations and being very upfront about talking about violence prevention is doing anti-oppression work, right? And understanding that we need to connect the pieces. And so a big piece of that also is, realizing that prevention work isn't just prevention work, right? We need to be advocates. We need to be helping folks be matched with resources, right? Making sure we're letting folks know of all the food drives that are available, making sure what clinics are available for free, walk-ins, all of that, right? Making sure that we're communicating with them and asking them, what is it that you and your family need in this moment? What can we do to help you with that? So it's also sort of doing both, right? It's doing prevention work and intervention at the same time. And I think that's one of the values of, the work that we're doing and really listening to what it is that the youth are telling us they need. Because it's not helpful for me to make assumptions and think, oh, what we're gonna do. No, I need to hear what the youth are asking for and really give them exactly that.
I agree 1,000%. That's fabulous. I know in Santa Clara County, you know, and we heard it actually with both our opening lawmakers. The time is now to double down on these efforts, right? We need them now more than ever. So despite the economic crisis, we are very fortunate. For example, our office just released a 1.5 million RFP call for proposals to address prevention and intervention, because we need to be funding our community to do this important work. And, you know, I can also say as a mom, I have an 8, a 10, and a 15-year-old. We can start talking about, you know, consent and healthy relationships with toddlers, right? It should be a part of our life. But really getting into the youngest classes possible, and especially middle and high school where so much is happening. But even earlier to really talk about these and work on these issues so that we can truly prevent some of these things from happening. So I want to remind everyone that, you know, the downside to having to be on Zoom is that it's harder to have a conversation, and we really want to have that. So we really do want to encourage you to put your comments and questions in the chat and Q&A, because we will make time to get to that too. And I also, I think maybe we can move on a bit, but thank you so much for that context and the importance of really supporting and investing in this, especially now. So.
Excuse me, may I just interject really quickly?
Oh, I'm so sorry, yes.
I would be remiss if I didn't highlight the intersection of the fact here in Skid Row, its predominant population is elderly. So Black women, middle-aged elderly women tend to track as one of the highest demographics displaced into poverty and homelessness. And this is not just year after year, but it's literally decade after decade by huge disproportionate numbers. So when we think about this intersectionality of poverty and homelessness and living out here on the streets, then we have to then talk about then how the women are commodified living out here on the streets and oftentimes deemed as tent wives and left to vulnerable, vulnerable environments where they have really are at the predatory instincts of those men and so forth who they seek for safety and for comfort. Also, I just have to intersect the intersectionality of the fact of when we talk about age and ethnicity, then the comorbidity issues of of health, of hypertension, diabetes, lack of food and food deserts, and access to, we mentioned earlier, water, clean water, water to bathe, water to clean your hands, safe distancings and all of these things. So I just wanted to make sure I highlighted those. Thank you.
Oh, Suzette, thank you so much. This is exactly why we have this amazing panel, because, and it's perfect actually when you think about what the next question is. And I hope you'll have more to say on this too. And this is really for all our decision makers out there who are listening in. So there are sometimes unintended consequences in efforts that are made with truly good intentions, but they might have actually a negative impact on survivors or on efforts to prevent violence. And I can think of one example. When COVID first hit, one of the things we needed to do was really decrease the number, the population in our local jails. And that is absolutely true, right? But at the very beginning, survivors were not being notified that people were being, their abuser was being released, and that increased actually danger in our community. And that was something that could be fixed, and it was not the intended consequence, but it happened, and people worked really hard and fast to make sure that changed. What you're talking about, like really looking at all these different intersections, I would say if you're not answering, or if you're not asking, how is this impacting older women? How is this impacting, any population that you're trying to serve? If you're not directly asking that question and able to answer it, it's very likely that you are going to be failing them in the solution, right? Everyone should be part of the solutions that we're coming up with. But what kind of advice do you have for policymakers to avoid possible unintended consequences in their efforts. Do you want to start us off, Suzette?
Sure, I'd be happy to. So one thing that comes to mind initially is really the importance for folks to realize, here in Skid Row, when folks are displaced from the penitentiary system and so forth, oftentimes they come into a community such as Skid Row. And so I've been told over the years that I've been here that we have approximately 800 to 900 sex offenders that live in our communities. And that's not even highlighting, just predatory nature and so forth of individuals. I just have to also mention, just this past Sunday morning, I woke up to a domestic violence dispute right here in my building where I had to go, literally into action at 6 a.m. Videotaping, calling police. I ended up working for the next 3 hours with police, LAPD, paramedics, the victim, after so on and so forth, after watching this man punch this woman like she was a punching bag. And then I had to, upload the videos and send all this information to LAPD as well as to corporate, and I live in a permanent supportive housing building, mind you. So here I am as a survivor, as a resident. And when we talk about quality of life and living in impoverished networks, that never gets equated into. So there is this currency of labor and of labor, as well as being a survivor of trauma, that never really gets factored in when you're on the front lines as someone like myself. I just have to lastly say that I came inside after dealing this for 3 hours, and my body revolted against me. Mm-hmm. Because as we know, according to Bessel van der Kolk, doctor who wrote the book, The Body Keeps the Score, that's trauma then that gets embedded in our DNA and is re-triggered at some time inevitably because there's no place to really deal with it. And so our body has to then deal with it. Thank you.
Thank you so much. And so true, the impacts. And I mean, it leads to chronic disease, all sorts of things that we know our body manifests when exposed to this. Aria, would you like to weigh in on this around, how to sort of avoid possible unintended consequences with, efforts that are being made with good intentions?
Yeah, I mean, I think as someone who has wrote and supported different legislation, every single legislation that I've ever worked on has inadvertently had unintended consequences, right? For instance, we did the nation's first sex worker protection policy here in San Francisco. It was then replicated at the state level, first by Assemblymember Friedman, and then again by Senator Weiner. The policy is amazing in that it explicitly defines sex work, right? And so much of the lens when we think about survival sex work, unfortunately, comes from human trafficking. And the two are different things. And so when we think about laws like Fosta Sesta, right, they're designed with the idea that it would address human trafficking, but implementation-wise, it always ends up being implemented against people who are doing voluntary sex work, people who are doing survival sex work on the street. And so with our policy, it defined giving sex workers immunity, right, who are witness or victim to a violent crime, and certain layers of crimes, right? And unfortunately, as time went on, the legislation passed, and law enforcement started using it as a way to get sex workers to be informants, right? Which was not what we were intending on doing at all. We were not intending for the policy to then manipulate sex workers. It was to protect sex workers. But of course, the larger effort to decriminalize sex work meant that we had to take that L with the unintended consequence in hopes that we could, in due time, come up with a policy to undermine that ability of institutions to manipulate it against people in the sex trade. I think for policymakers, it's very important in the policy world and in politics, it's very easy to think of people, first of all, as large groups, and to think of them as single issue people. I think it was Audre Lorde who said that we're not single issue people. And so that, I think, is the most important thing as we talk about intersectionality, right? The idea, the reality is that people hold multiple identities and experiences that then impact them when we think of legislation. Every issue is a Black issue. Every issue is a women's issue. Every issue is an immigration issue. Every issue that you can think of on the planet applies to multiple people. And I think policymakers and their teams have to be more critical in their approach about thinking about impact when they decide on legislation priorities and how it'll benefit certain communities and how it will create a disadvantage for others. For me, I am not just a trans woman, right? I'm also a Black woman. I'm also Black. I'm also a woman. I'm also under 35, like, right? All those things influence my worldview, and then also how I am impacted when we think about policy and ways that we are, impacted, the unintended consequences that end up happening. Every legislation is always going to have unintended consequences, but I think as long as policymakers are aware of that and attempting to minimize those, and then also making a commitment if there is a very blatant unintended consequence, sort of ethically ensuring that in the next legislation cycle that they're introducing policy to minimize those consequences for the future.
I love that. Thank you so much for summing it up like that, because I don't know that we can do any one piece that would really, completely address everyone in the way that everyone should be. But you're right, it takes constant monitoring. It takes constant working on this. It's why we're all going to be doing what we're doing for the rest of our lives. And it's important work. And I just want to remind everyone out there, we have amazing experts in our community that we should be leaning on for all of this to make sure. So if you haven't been including community in your analysis, that's the first place to start for sure. And so I'm going to move us on just because we're starting to get a little short on time. And actually, I think, Arya, you would probably be the best person to lead this question, but it's important that we talk about this. And so I'm going to ask you to answer first. But what systemic barriers exist for transgender and gender non-conforming survivors as they seek support around healing, as well as accountability from the person who has caused them harm? And has COVID impacted this experience or these experiences?
Woo!
I know.
Where do I start? I think I can give, there's so much, right? There's so much there to unpack, but what I can express is that I am grateful for this moment that we are in right now because, and only this reason, is because people are literally waking up and seeing the inequities that exist in so many ways in this country and around the globe, right? For trans people, the American public has this idea that we just fell out of the sky in 2007 and that we're hanging around and we're like taking over pop culture. And then we are, right? But trans people have existed since the dawn of time. I think what people, everyday American people, what they are witnessing is trans people having agency, right? For so long, we were the punchline of a joke in a movie. We were the content on Jerry Springer and not much more, right? We were the kitchen table talk that grown folks would have if they drove by and saw trans people doing sex work, you know, late at night, right? Like those are the things that people had associations to trans people. And I think now you see us on television and on Netflix and on red carpets and or people like me, like in social justice work. I think what is important to note is that trans people are currently experiencing a genocide. You know, I think you can't gloss that over. And no one really knows how to address it. But what we do know is that this year has been the deadliest year for trans women of color in the United States. We're a very small population, and I have to emphasize that because the internet and social media, so many more people have access to trans people, and more and more people have met or had a connection with a trans person at some point in their life, now more so than ever before. However, we make up less than 1% of the American population. And then when you break it down by race, it's extremely small. And so when over 30 Black trans women have been murdered gruesomely in the ways that we are at the hands of men, cisgender men, and it is normalized in our culture, right? Now the media says number 30, number 21, number 18, her body was chopped up and in a suitcase. Her body was this, she was thrown off of a bridge. She was done, like, and then we share the articles, right? Because we're on high alert and we're hyper vigilant. And then we don't know what to do. There was a young trans woman, Iana Dior, in Minneapolis, I believe. And her attack went viral. She survived, but she was being beaten up by 15 cisgender men. And no one, the people filming, the corner store patrons, no one jumped in. No one said anything. No one said, hey, y'all, stop. They just watched it happen. And trans women in Los Angeles recently, they were being robbed. The police came by and laughed at them and drove away, right? Like, and they were being robbed and attacked. Someone pulled out a crowbar. It's all on camera. And still, the men that perpetrated it were able to sort of be dismissed with a slap on the wrist and no restorative justice whatsoever, right? And so I think...
No, go ahead. Go ahead. I didn't mean to interrupt.
I just, the moment that we're in, I'm so grateful that more people are awakening, and so many allies and cis people and have messaged me like, what do we do? How can we? And I'm, you know, I confessed on Facebook earlier this week, I don't know anymore, right? Because we're all trying to figure out how to stop the violence. I do know that we live in a culture that consistently attacks women and undervalues Black, cis, and trans women, right? This is something that we know. I think anecdotally, we don't need evidence to prove it. We see it all the time, but it's something to be aware of. And with that, I do also always want to offer that our community is extremely resilient. We're more powerful than our minds can digest. And I think if given opportunity to be empowered economically and socially, I think we will and are doing incredible things in this moment at the same time that we're experiencing a height of disparity. I think structurally, we're also seeing amazing changes. Michelle and Bambi Salcedo of Trans Latina Coalition, they've been working at the state legislature with, I believe, Senator Wiener, and have helped pass legislation that will allow trans people to be housed, if in prison, by their gender identity and not their sex assigned at birth, right? The PREA documents, I forget what the acronym means, but they have assessed...
Elimination Act, and yes.
Yes, so many trans people have been vulnerable to sexual and physical assault in ICE detention centers and in prisons, because of their gender identity being, and oftentimes trans women being housed in spaces with cisgender men. And so obviously we don't want any of our folks in prison, but this is a harm reduction strategy to minimize the harm against trans people who may be incarcerated, right? And being able to determine for themselves where they will be the safest is only gonna to create and maximize safety for our folks. The Women's Foundation of California is doing really amazing work at expanding what gender justice looks like, and intentionally funding and supporting transgender-led nonprofit projects, advocacy projects, to ensure that they're able to do their work in the gender justice scope of work, which means a lot to me. I'm on the board of Women's Foundation, first trans woman on the board, but also just very important to know that as we are united in panels like this, right, where we have a gender expansive conversation and talking about the issues that each of our communities face, that seeing that we are united under a common fight for equality and liberation for all women and girls and trans people, I think these are the moments that we also get to celebrate. Like, we're in the fight and we're doing the battles and in the trenches to make change for our community, but also celebrating the amount of progress that we're making. At the end of the day, we know that the institutional violence exists for trans people. Trump and his administration have been very vocal in stripping away the little tiny bits of rights that we had before Trump. Like, Obama mentioning the word transgender was like this iconic thing, but that was not enough for me. I'm sorry, I'm never.
No, I agree. And I want to thank you so much for summarizing so many important points. We must work together on these issues. I think you made it very real when you use the word genocide, right? I mean, this is a crisis, and we all have to consciously and intentionally work to be more inclusive and to specifically address the violence against transgender Black women in particular, but transgender women is some of the most horrific our world knows. And so we have a lot to do, and I love your optimism and hopefulness that we are going to make a difference in this. So I want to thank you for that. Now, we're running short on time, so I'm going to switch gears a teeny bit because we do have a few questions from our participants, and then what I'll do is end and ask you all to give a almost like a lightning round recommendation you have for the legislative cycle. But I think it's important to hear from our participants too. And actually, there was a specific question for Suzette, and Elizabeth wants to know if you can share how the Skid Row population is being impacted by COVID, and if there's testing, or if you mentioned this at the beginning, but if there's been any hygienic measures being implemented to help support this, especially because of COVID.
Hi, Elizabeth. Yes, thanks for your question. So they are actually doing testing and in different sections of Skid Row. It's approximately a 50-block radius that we actually exist here in downtown LA. And so I haven't heard as of late where the current testing is going on, but it does tend to rotate. And it's also available, from what I understand, at the local clinics if someone wanted to get testing as well. It is available. And periodically, I know that they actually even come to our different residents. Most of us tend to live in either permanent supportive housing buildings or SROs, single room occupancies. So from what I understand, they have rotated to different demographics to help serve us right on site as well. They did at my building a few months ago. So I do know that it does open up at different times. Thank you.
Carla, you're muted.
Carla, you're muted. We can see you talking.
Okay, I was saying great things too. Thank you for that. And thank you, Suzette, for answering that specific question. We have a question for Kalila and possibly for Jessica from Dr. Gallardo from San Jose State. I want to give a shout out to SJSU. And she's wondering if you can, we've talked a lot about how, actually all of you have talked about how violence is really normalized in our community, but her question is specifically about social media and stalking. And if either of you want to weigh in on that at all.
Okay, I will.
Thank you.
Social media stalking. I feel like social media gives a lot of people access to individuals they wouldn't have access to in the real world.
Mm-hmm.
That's why I would say I like to keep my social media accounts on private so I can accept people that I know, just because I don't want random people knowing what I'm doing or where I could be at. But then also I feel like that falls under watch what you post a lot, because on Instagram you can put your location. I wouldn't put a location of everywhere you go. I think you should try to keep your life private. If that's what you like to do, that's fine. I'm not telling anybody how to live, but social media stalking is real. And if you have an Instagram, sometimes, I don't know if you guys ever get random direct messages from weird accounts. Social media just gives people a lot of access that they wouldn't normally have in real life. That's why I think it's really good to try to stay on private so you can accept who you want. So leave it up to you to pick and choose who you want to have access to you.
Thank you for that. Jessica, did you want to add anything? Thank you.
Absolutely. Thank you so much. Those are great recommendations, Kalila. Thank you for sharing. I do agree that tech safety is a very important thing we need to talk about and normalize, especially in our virtual world that we're all existing in now. I think the reality is that we don't notice or we don't realize how much information we share when we're online, right? And this can be through social media, in our email, when we're browsing the web, when we're on YouTube, when we're commenting on blogs, right? We don't realize how much information we're giving folks. And so it is important to talk about what options exist to maintain your safety online, right? And those can vary widely, right? Like Kalila mentioned, not sharing your location, right? Making sure, even like taking pictures, right? Where are you taking pictures? Are you taking pictures in front of your home where you can see the address, or you could see an identifying factor? When you're, I know now, like a lot of security systems online with our cars, with our homes, on our phones, right? They like automatically sync up to a cloud, and it's for folks who know how to hack. That is easy information for them to access and to then be able to use it for harmful purposes, right? So we have been in the process of developing an online tech safety workshop and presentation recommendations to just share with folks, and just like a quick tips of how to ensure your safety online and virtually, because we know that it's real and it's happening all the time.
Those are great. Our office is actually hosting a month-long series of free webinars. So if you go to our website every Friday this month, we have incredible panels, and we have a three half-day series on strangulation response for those who are working in the field and might be interested in having that training. It's incredible. But we had one just recently on tech, and actually everything you're saying is absolutely true, but it's just really scary, kind of the things that are out there. And so much of this is not even really hacking, because you might just, when you're together, have your friend share passwords or things like that. It's really just they have access, and really thinking about all the different ways that we give access without realizing it. So that was just one thing I walked away with that I thought I'd throw in. So we are actually out of time for this amazing panel, and I am so grateful to each of you for all that you've shared with our community, because it's really important, and I think can lead to incredible legislation and policy and prevention throughout the state, which is really exciting. This collective wisdom is incredible. And so we're going to have some in-depth speakers from the California Partnership and from Alliance from Girls. So what I'm going to ask you is if each of our panelists who want to, in the chat, put down what their recommended policy might be for the 2021 legislative cycle. And that way everyone can still see it and we can all follow up on that. But I don't want us to miss out on our other speakers that we have today. So I want to thank you all so much from the bottom of my heart for making this such a meaningful, incredible time. Thank you. And back to Protima.
Thank you. Thank you, Carla. And yes, I want to echo Carla's words. This has been so much learning and the intersectionality and the truth telling that's happening. I hope that all of us have spent the morning exercising our think tank brains, because in a moment you're going to hear from Halima Barucha, who is the policy advocacy specialist over at Alliance for Girls, and Krista, who is the policy advocacy director for the California Partnership and Domestic Violence. The most important thing that I'm hoping that we can learn today is that there isn't a one-story solution. I know Arya said it best when Arya reminded us of how we need to bring our intersectionality and ensure that as we are talking about policies, about programming, about prevention, that we are able to bring our entire intersectional lens, but we won't know what we don't know. And so this forum and similar spaces of these kinds are where we reach out across the aisle and say, let's work together. I know back when I first began this work, I used to have difficulty even asking about services for interpretation for survivors in court, no less. And today I know there's a wealth. And in fact, one of the pieces at the Domestic Violence Conference that Carla just mentioned this past Friday was on translation for survivors. So I feel that we have come a long way. There's a lot more to go. So I'm going to turn it over to Krista and Halima to add policy pieces. I also...
Great, thank you so much, Protima, for that introduction, and thank you to all of our panelists for everything that you shared. It was really wonderful to get to hear your collective wisdom. So as I get started, I really just want to say from the California Partnership to End Domestic Violence that prevention is a core part of how we approach these issues. And here during Domestic Violence Awareness Month, it's really essential to us to not only continue to raise awareness about the violence that does occur, but also about the need for prevention. That our goal is to create a world where domestic violence no longer exists. And while that may be a lofty goal, we know it's doable. And I have the privilege of working alongside folks who are doing that every single day. It's essential for us to support survivors, but also to change the conditions that allow this violence to occur. And I think what you heard from the speakers on the panel was really illustrating so many of those conditions, right? As Arya spoke about economic insecurity, and particularly how trans folks are so often left without access to unemployment benefits and other social safety nets, we know that economic insecurity is a real risk factor for domestic violence. We know that as folks stayed home during the start of the shelter-in-place orders, everyone was very worried about the increase in violence. And we should be addressing that. But I think it's really fundamental to acknowledge that we should not take that for granted as a condition of our society. That the requirement to stay home with your most intimate partners means that there will be violence, right? It cannot be. And I can see Kalila putting in the chat that it's beneficial to fund prevention efforts. And absolutely, this has been a huge priority for the partnership. We've worked closely with the Coalition Against Sexual Assault, and for 2 consecutive years in the state budget, we're able to get new dollars to support prevention of domestic and sexual violence. It was $15 million over those 2 years. Unfortunately, we all know that the state of the budget this year was much grimmer, and those dollars did not continue, but it remains a really essential priority. I think it's also a big part of our work of why our prevention or our policy priorities, which you can see on the screen, address a range of issues, right? As Aria mentioned on the panel, no one is a single issue person, right? Our lives are complicated. Our lives hold multiple identities and multiple needs. And that when we talk about these issues, it's important for us to think about them not only for the ways that they can support survivors, but how these issues can help prevent violence from occurring. So when we think about funding, right, we think not only about the intervention services funding, which is what the state provides and what the overwhelming majority of federal dollars are limited to. But we also think about the need for funding for prevention services and the need to find a way to do that even in really hard budget times. When we talk about economic justice, some of the big things that we're focused on for this year, one in particular is continuing to be an active member of a work and family coalition here in California that helped pass, or led the effort to pass a paid family leave extension, SB 1383 by Senator Jackson. One that our opening speaker, Assemblymember Wicks, was instrumental in passing a key vote on the floor that many of you may have seen referenced in news media. But those prevention-focused types of supports, right? When we provide paid leave, the ability for folks to take time off to be with their families, we help prevent stress in families and we help prevent violence. When we think about the impacts for survivors, for the partnership, we're really focused for these coming years on the devastating impacts of financial abuse. Survivors are left often with tens of thousands of dollars of debt that they did not incur, that they often did not know was taken out in their name. We talked about tech and stalking, but there are so many ways to steal your partner's identity when it's your most intimate partner. So we know that that has had crippling effects for survivors, as has really destroyed credit scores and spotty employment histories as results of abuse. So there's a lot to do there. We'll also be doing a lot around housing and homelessness. Folks don't always think about it this way, but every domestic violence shelter is a homeless service provider. Fleeing or attempting to flee domestic violence is embedded in the definition of homelessness from our federal level. And yet far too often when we talk about homelessness, we aren't talking about domestic violence. But for survivors and for women, this is a key intersection. So we have a lot of work to do to change that narrative. And to make sure that funding for homelessness programs goes to support survivors and the services that are working with them. But we also recognize that what's fundamentally needed is housing and housing stability and housing security and the ability for families to pay their rent, pay their mortgage, and be able to stay safely and stably housed. And that when we can do that, we help prevent violence. We help prevent domestic violence from ever starting. One of our key issue areas is also taking a hard look at the criminal legal system, which has for many decades been a key area of reliance and focus in terms of solutions. But we know that the system harms too many survivors, right? Especially our Black and Brown survivors, especially survivors who are LGBT community survivors, right? We know that too often they are harmed by this system. And there's a lot of work we need to do to continue building alternatives to the criminal system so that survivors can find the supports that they need, but also to address the ways that the system is causing harm. Prevention, as I said, prevention is embedded for us across our thinking about all of our issue areas, but we would never not also call it out because it is its own distinct issue when we are talking about primary prevention and the effort to stop violence before it ever occurs. So we'll keep working on that. We know there is so much to do. I know that from the last 3 years of work, there are so many times I've walked into the Capitol and said, we're here to talk about prevention. And they're like, what do you mean, services? No, prevention. We don't have to live this way. We fundamentally do not. And there's a lot to do to continue educating on what prevention looks like, continue telling the stories of success. So Kalila and Jessica, the great work that they're doing to change, our culture with young people and change those conditions. we need to keep lifting that up. So we will be bringing that to the legislature and continuing to talk about that. And then of course, immigration, right? I know this was already lifted up in some of the panel responses, but there is a lot to do. And the way that our federal immigration response has harmed so many is a key area of work for us in both defending against harmful policy and continuing to, you know, advance and support positive policy, continuing to work with our partners at the state level and also at the federal level to move forward what we can. So I know we are super short on time. I'm going to stop and let Halima close us out and share their priorities.
Thank you so much, Krista, and thank you to all the panelists and attendees who've been here with us today. As an advocacy manager at Alliance for Girls, I'm here representing over 100 Bay Area girl-serving organizations and the 300,000 girls that they serve annually. When I say girls, I'm referring to gender-expansive youth, which includes cis girls, trans girls, non-binary youth, gender non-conforming youth, gender-queer youth, and any girl-identified youth. Today, I'll be sharing a little bit from our Girls Policy Agenda. And for our Girls Policy Agenda, we've had 3 primary focus areas in terms of policy. 1, equitable resource access. 2, systems accountability to girls. And 3, safety from gender-based violence. And I'll be focusing on the last one for today's briefing. As you've heard from our earlier speakers, violence prevention takes on many forms. At Alliance for Girls, we're intentional in centering girls and gender-expansive youth in our efforts to prevent violence. The cycle of violence is generational and it starts early. For us to truly break the cycle, we must start early. And that is why at the center of all of our work as policymakers, as advocates, we must have girls and gender-expansive youth in the center. Gender-based violence does not happen in a silo, and many factors play a role in adding or reducing risk from gender-based violence. Safety from gender-based violence needs to be built into all of our systems so we can transform them to systems of empowerment. And so the following policy recommendations that I'll be presenting to you are co-created by Alliance for Girls and our advocacy committee members, who I'm very grateful for the coalition work that we've been doing over this last year to push for these changes. And we're urging policymakers and advocates to prioritize these frameworks and solutions in the 2021 legislative cycle. Please reach out to me if any of these resonate with you. We are looking for legislative champions this year. And so the first recommendation I want to start with is funding community solutions for safety from gender-based violence in the budget. And this is really important, you know, as we're moving towards defunding the police, as we're moving towards shifting the way our budgets work, we must redirect funding to community solutions that fund safety from gender-based violence. Historically, we know that police-centered responses to gender-based violence have caused more harm than good for communities of color. The fear of racialized police violence or policies like mandatory arrest in response to a call for help are barriers to police-driven responses being effective. Personally, I've also grown up in a community where I've seen gender-based violence and experienced harassment myself, but never sought help through the police system due to this very fear. As our nation collectively reckons with the racialized police violence and makes strides towards defunding police, it's critical that we invest in community solutions that center survivors, that are trauma-informed and culturally responsive. Alliance for Girls has seen the effectiveness of this model through our local advocacy to create leading models on sexual harassment prevention policy in schools and on public transportation. And it's critical, like I said earlier, that we embed this framework into all of our systems, right? And for example, one of the places where we're urging policymakers to really think about is public spaces, right? So many instances of violence, as our panelists talked about, happen in public spaces. They happen while people are watching. And our ability to move safely through public spaces to access resources and support are critical for violence prevention. If I cannot get on a bus and say I can safely go to access a resource, that is a barrier to access. And so we're urging all California public transportation agencies to have a mandate to create and implement a gender equity action plan to make sure that sexual harassment and gender-based violence that are girls and gender-expansive youth, as well as others that are facing, are being addressed. There is a model that Alliance for Girls has been able to create through a landmark policy that we passed with BART this last February towards addressing this issue. With girls and gender expansive youth at the center, with community organizations at the center, we've been able to develop a model with the support of champions like BART President Latifah Simon on how we can address this. Please reach out to me if you want to get more details about what this can look like. We really urge all agencies to adopt a plan like this. Secondly, it's important that we address sexual violence in K-12 schools. This is something that we've long known as an issue. We've seen this happen, and one model that I would like to point to where we can look to for what we can do in create alternatives is the Oakland Unified School District. This is a place where Alliance for Girls was able to co-lead a process with girls at the center to reform the Oakland Unified Sexual Harassment Policy. The policy that we were able to co-create, which includes affirmative consent standard, it includes a district-wide, a school-wide response to sexual harassment, it includes trauma-informed language, and inclusion of restorative justice processes. This is a model that we need to be looking to and something that we are urging schools to adopt. Our students should not have to worry about their safety while they're trying to access education. Also, we want to share during COVID-19, it's critical that our response to COVID-19 centers violence prevention and intervention. As you've heard from the panelists, COVID-19 has exacerbated some of the pre-existing inequities and conditions that we've seen facing our communities. Funding for COVID-19 response and recovery must have a violence prevention lens. We saw that in March 2020, for the first time ever, half of the victims receiving help from the National Sexual Assault Hotline were minors. Of the minors who discussed coronavirus-related concerns, 67% identified their perpetrator as a family member, and 79% said they were living with that perpetrator. This is deeply, deeply concerning, especially considering the fact that for us to be safe from COVID-19, many of us are being asked to stay home, but home is not a safe place for all of us. And we know the rise in child abuse is extremely alarming, and it's something that we must address. And so we're recommending that as folks think about the COVID-19 response and the recovery period, that we are really bringing a violence prevention perspective to this. In our own youth-led COVID-19 survey of California girls and gender expansive youth, we saw that over 65% of over 800 respondents said that they were experiencing violence in the home. And over 11% said they did not have access to private communication with a caring adult or friends. And almost 14% said they did not have access to a tablet, computer, or cell phone with Wi-Fi. This is concerning when you put all these factors together and really think about what that kind of social isolation and resource deprivation will look like. We are asking for policymakers to make sure that there are resources available for students that are easily accessible through online learning platforms so that young people can get a way to seek help, to seek resources for prevention and intervention. And finally, we are urging policymakers to enhance protective factors from violence. Protective factors from violence are a core aspect of gender-based violence prevention, and they're even harder to access now because of COVID-19. Risk factors from violence risk factors and protective factors can affect an entire community. They can occur in interactions with friends and family and within organizations and systems like schools. One example of protective factors is access to a caring adult or resource coordination among services and community organizations. The CDC's Connecting the Dot report states that by enhancing protective factors among communities, we can prevent violence from occurring in the first place and coordinate and integrate responses to violence in a way that recognizes these connections and considers the individual in the context of their home environment, neighborhood, and larger community. Our panelists also spoke to what the lack of resource access can do. And in our own COVID-19 research, we found that over 12% of respondents did not have access to food and groceries, 8.3% did not have access to period products, 22% did not have access to a job or source of income, and 9.5% needed help to complete their homework requirements. With many resources such as school programs, community centers being closed or shifting to online platforms, access to resources is absolutely critical. These are just a few needs that our survey has highlighted, and at this time, school sites and local community centers may be the only touch points for access to resources. Our own local advocacy in Santa Clara County and in other parts of the Bay Area to close these gaps found that there is a lack of coordination and in some cases, even awareness that these resources are needed. And so we're urging state leaders and advocates to ensure that these resources are being coordinated and provided for our most vulnerable communities. If we do not enhance protective factors, we are leaving room for the risk factors of violence such as resource deprivation to seep in. And no girl should have to decide between buying a period product or food. No girl should have to face potential financial strain and stress that can result in violence or exacerbate existing violence, especially not in the middle of a pandemic. Thank you all for listening. I want to just share that as I close out, I'm dreaming and working towards a society where our success is measured by the most marginalized girl. Thank you so much for your time, and please reach out to me if you have any questions or if you would like to get in touch with a panelist. Back to you, Protima.
Thank you, Halima. And as we close out, I see in the chat there's a request for Halima slides, and I will let Alliance respond to that request. And I want to tell everybody that today is the beginning of us coming together at this difficult time. But for us, the most important